Good morning, everybody. Welcome to today's webinar. I'm so glad you could join us. I'm going to turn off my camera now so that we can focus on the slides. Just turned on to say hello. Everybody's cameras are turned off or disabled, so are your microphones. If you have any comments or anything you'd like to share, you can, of course, type in the chat box. And you can use the reactions, so give us a thumbs up if you're enjoying the content, etc., etc. Thank you so much for joining us today. Today's webinar will focus on the importance of cleaning brushes, a very simple, or so it seems simple tool, but a very, very important thing for cleaning efficacy. Today's webinar is brought to you by SafMed, and SafMed is your solutions partner in both the CSSD and the operating room, and has been so for over 35 years. So thank you, SafMed, for sponsoring today's presentation. Some of you may not be aware, but SafMed Education does have a YouTube channel, very easy to find. Go onto YouTube, just Google and type in SafMed. We have over 40 webinars now on our system that you can go through, look at, record, view. Of course, for each webinar that's available, there is a test. If you complete that test, you will receive a certificate of attendance. We now have over 13,000 views, so numerous people have made use of these training sessions, and hopefully you can go ahead and do so as well, including topics like effective cleaning. There's 3 in that series, 2 on maintaining sterility, cleaning chemistry, sterile barrier systems, the importance of tracking and tracing in our CSSDs, and the latest one from this year was mastering high-level disinfection. Now, when we sent out the invite for this particular webinar on the critical role of cleaning brushes, we focused on these things, and we said that using a cleaning brush, or the correct cleaning brush, is actually vital, and it's vital for ensuring thorough cleaning. It's vital to prevent damage to delicate instruments, and it's really an important thing for reducing the risk of infection. And as we said, in this webinar, we're going to look at why we have different types of brushes, why they matter, how to use our cleaning brushes effectively, and the best practices to maintain our brushes that we do own. So let's dive into the detail. Of course, for cleaning to be effective, we need a whole lot of things, and I think you all know that. We need detergent. Of course, detergents help to break down, to loosen, and to assist in the removal of various contaminants or soils that are on our surgical instruments and devices, like proteins and lipids, fats. We need friction, and friction is produced either mechanically or manually. So, for example, in a washer disinfector, friction is created from that really strong flow of water, or in ultrasonics, from the cavitation in the ultrasonics. But of course, friction from a manual cleaning perspective is rubbing, brushing, scrubbing. Water, again, a very important component. We need it to help with the removal and the rinsing away of the soils, as well as the detergent residues. All these together help us clean effectively. As we, I hope, all know by now, that if a device or an instrument is not clean, the next step in the process, be it sterilization or high-level disinfection, will be ineffective. And that, of course, can lead to a patient developing a surgical site infection. Surgical site infections are defined as infections that occur in or around surgical sites, usually the incision, typically when microorganisms are introduced at the time of the surgery, for example, when a contaminated device is introduced into a patient. Of course, surgical site infections can be acquired during an operation, sometimes, but not always necessarily, but certainly it is a high-risk area, and they can be acquired from the operating room environment, from the microorganisms from the staff themselves, from the microorganisms on a patient's skin, so their own microorganisms, and of course from the medical equipment or the surgical instruments. The image on the right over there was in fact an outbreak of infections that occurred a few years ago relating to laparoscopic surgery, and it was in fact a mycobacterium infection where numerous patients were affected. A horrendous outbreak, and as you can imagine, none of us want our patients coming back with pus. Of course, why do we clean? The definition of cleaning: removing of contamination or soil from an item, an instrument, or a device to the extent necessary for its further processing or its intended subsequent use. So we need to get it as clean as necessary for the next step in the process. There are different types of soils that we can find on our particular instruments. Those soils can be organic, they can be inorganic, they can be from the patient themselves, or they can be from the products that we use on the patient, from all sorts of things, as you can imagine. I'm sure you know them, various fluids that we use, antibiotics, products, cements, all sorts of things like that can contaminate our surgical instruments. And of course, we need brushes and implements to get them clean. Now we've already spoken about those three basic elements of water and friction and detergent, mechanical action, chemical action. But in fact, also the time that we do cleaning or we clean for matters, as well as the temperature at which we clean. So the temperature of our detergent water mix is very important. So all of these four concepts are in fact interrelated. So, for example, if you have too little detergent, you might have to compensate by cleaning longer, or by using better temperatures, or having more mechanical action, or more rubbing, or more scrubbing. If you've now prepared a sink of water to do manual cleaning and the temperature has decreased, remember the temperature helps activate the enzymes in the enzymatic detergents. If the temperature is now decreased, you might need a bit more chemistry or a bit more mechanical action to actually achieve a very effective clean. And these four variables that are interrelated is known as Sinner's circle, a very important concept at the end of the day for cleaning. Now, you may well very well ask yourself, now, how am I going to clean a particular device? How will I actually clean it? And I'm going to need to look at the device. I'm going to need to look at the design of the device, what it's made of, the various substrates, because that's very important. Is it something that I can dismantle or not? Is it something that has got blind corners to it? Has it got hinges? What type of design is it? And what type of surface is it? Is the surface rough? Is it smooth? Is it a device that can be immersed into fluid or not? Is it something that I can only wipe off? All of these factors I need to take into account before I can actually clean it. And really importantly, what does the manufacturer's instructions for use say about this particular device? Without the manufacturer's instructions for use, I really do not have very good guidance. It's very important that I understand what the manufacturer's instructions for use are. So we're going to use this set of instructions for use as an example. It's from some orthopedic devices from one of the suppliers that we know of instruments and devices that we use in the country. Certainly this one focused on instruments used for hip and knee replacements. So these are orthopedic complex devices. I'm sure that you've worked with them before and know how complex they are. Here's what the instructions for use started with. It said over there under the section of manual cleaning tools, hospital tools necessary for manual cleaning include several brushes of various sizes and lengths, pipe cleaners, and soft low linting cloths. It went on to say that you should not use abrasive cleaning tools like scouring pads or metal brushes, clearly stated in this IFU. It says cleaning tools must be cleaned and inspected after use. And it said brushes should be clean. It said discard worn brushes and disposable cleaning tools. So clearly in the instructions for use from the manufacturer, this is what you need. Important to follow those instructions, is it not? Now, at the moment, there is an ISO committee that is in the process of creating a very new document. So it'll probably take about another year or so before the document is released. But the document and the members in the committee include Terry Kramer, who published this research, and we're going to focus on her research in a minute. But it's really about the fact that our instruments and devices can be extremely complex, and it's very important that we understand the complexity of each device. And this new standard is going to be to help us as end users and as manufacturers at the end of the day, to help the manufacturers as well, define and understand what we mean by a complex device. And in the research that they published, what they had done was worked with a number of different instruments, contaminated them with all sorts of soils, and looked at how hard it was to clean different types or designs of instruments and geometries of instruments. And I think there's a really good statement that Kramer et al. Make, and it says over there that possibly the greatest misconception in sterile processing is assuming that all reusable medical devices pose the same level of difficulty when it comes to cleaning, because they don't. Different parts or structures are very, very important. And I learned new words like mated surfaces. I didn't know those words existed. About lumens and springs and hinges and more in-depth geometry of actual instruments. So looking at the graph over here, you can see that these particular devices, like mated aspects, like mated surfaces and rough surfaces, are quite difficult to clean. But look how really hard it is to clean threads and blind slots. They are exceptionally hard to clean. So this research was focused on instrument geometry, and at the end of the day, helping manufacturers to learn when they design what they need to take into consideration to try and make the design of the instrument as effective, as easy for us to clean, but also for us to understand scientifically what is difficult and what is the actual feature that is hardest to clean, to teach us about the cleaning. So back to that orthopedic company's view. So remember what the manufacturer has to do before they can actually sell you the device is they take their devices, all of the instruments, all of the things that they've now manufactured, and they contaminate them with a known amount of microorganisms and soils. They then put the devices through a series of processes of cleaning. They document all of those processes, of course, and then they give you a set of instructions for use, because they have to tell you that if you follow these instructions at the end of the day, you will have a cleaned device. And that's their responsibility, because they can't just design something and say, here you go, use this, this will do the job, it's perfect. But how on earth are you going to clean it? So before they can sell it to you, they have to have done this. But remember now, that then means for you to actually clean a device effectively, you need to follow their particular instructions for use. Now, the trick is, over the years, we've learned to clean things, and we've been cleaning things in a particular way. And then perhaps we move from one make or model of a device to another, and we make an assumption that we can just clean them all the same. But that's not true, because you really and truly have to follow those instructions for use. If you have an outbreak of infection, the lawyer is going to ask, did you follow the instructions for use? That's the first starting point. And the question is, do you actually have them? Have you ever read them? So we were giving some advice to a particular company, and as a result, we got to learn these very detailed instructions for use. So this is the same set that we spoke about earlier, going deeper into the document. They divided into devices without challenging design features and devices with challenging design features. And the instructions are slightly different for the two different types of instruments. Again, the complexity of the instrument matters here. Focusing on the devices with challenging design features, they go on to talk about what are challenging design features. Here they speak about reamers, T-handles, cable passes, cutting blocks, and hinge clamps, for example, are actually defined as complex parts of their instrumentation. And they talk about pre-rinsing with cold water, immersing in soaking for 5 minutes. So this is just the manual cleaning process. Obviously, there was more to this. There was a manual process followed by ultrasonics, followed by automated washer disinfector. So I'm focusing on the manual step now. Here you can see soak for a minimum of 5 minutes. Then comes the scrubbing section. Now I just have cut and paste a little section of it. Scrub the lumens or holes with a brush of the appropriate size. Use a twisting action with the brush. So not only are they telling you about use a brush, but they're also describing how you need to use the brush. Open hinge devices and scrub the hinge area with a brush. Scrub the crevices, scrub the surfaces of the device with a tooth-styled brush. A toothbrush-styled brush. There we go. Not a tooth, a toothbrush-styled brush. So incredibly clear set of instructions about what you should be using and what you shouldn't be using. So very important, please, to follow the manufacturer's instructions. Now remember on the first page it says do not use anything abrasive like metal brushes or scourers. And orthopedic instruments are renowned to be difficult to clean. We know that, and I've seen many people use metal brushes on orthopedic instruments. But here is a clear set of instructions and reasons why, in some cases, you should not be using those abrasive brushes. If the instructions for you say use a metal brush or an abrasive type brush, then you use one. But if it clearly says do not, you should not be using that type of brush. Here's another paper that talks about complex designs. It says, complex designs of surgical instruments as a barrier for cleaning effectiveness, favoring biofilm formation. The authors go on to state that a complex design of some reusable surgical instruments is one factor that may negatively affect proper cleaning due to the areas that are difficult or in some cases impossible to brush during cleaning. And that's why people like Kramer, etc., are writing these papers. That's why ASO is establishing a new guideline to help us understand about the cleaning of these complex devices. Of course, cleaning is considered the most important step of reprocessing. We know that, and if not adequate, may contribute to biofilm formation. They then used a very fancy microscope to take some images, and if you have a look at the image on the top over there, that is a microscopic image of biofilm. Biofilm, large patches of biofilm that are developed inside a depth gauge. Depth gauge, as you know, is a common orthopedic device. We use it all of the time, but it's a complex device. You may think it's just a flat piece of handle with a little thing on the tip. It's not. Here we have biofilms growing in a depth gauge because it wasn't properly cleaned. Okay, moving on to cleaning brushes themselves. We define, or we can group them into 6 types: general brushes, toothbrush style, burr cleaning, channel or lumen cleaning brushes, valve cleaning brushes, or acetabular reaming type brushes. Of course, we all know that brushes have got some form of a handle. It can be a flexible handle, it can be a rigid handle, it can be a metal handle, or more of a synthetic material or plastic type handle, which contains bristles, and those bristles are also very important. A little bit of history for fun. In the ancient beginnings, early humans used all sorts of rudimentary tools like twigs, animal hair, and plant fibers to clean and groom and to paint with. In the Middle Ages and the Renaissance era, we started to use brushes, making use of hog bristles, horse hairs, and feathers. In the 18th and 19th century, it was a bit more industrialization, of course, and brushes were now starting to be made out of different materials and then being quite specific, ones for clothes, one for shoes, one for teeth. In the 20th century, we, of course, have our modern materials. Toothbrushes, for example, evolved from bone and pig bristles to nylon bristles. And every time I've seen a few different points where they refer especially to 1938 when we started to develop these bristles made of nylon. And that was quite a turning point in the world of cleaning brushes. And of course, in the 21st century, we have specialization and brushes now made from various synthetic materials and fibers, and very bespoke and very specific. So, like we have brushes that are made for cleaning a bottle, for example, at home for cleaning baby bottles. We have brushes that are designed specifically for the jobs we need to do in the CSSD area. How do I choose a brush? Well, obviously we need to look at, again, the design and the shape of the device itself, because that'll help us understand what size of brush we need. We need to look at the external surfaces. Are they rough or are they smooth? We need to look at the internal surfaces, again, the length and the diameter of those internal surfaces. And hopefully we now can choose a brush from what we own, or perhaps we might need to order a brush that's appropriate for this particular device that we now need to clean. If we're cleaning a lumen, of course, if you look at the image on the right over here, we can see that we're measuring the outer diameter of a lumen and the inner diameter of a lumen. Needless to say, the inner diameter is one that is going to be very important when it comes to the brush size. I'm using a pool sucker as an example. We've got an image of the pool sucker on the screen. I'm sure you all know the pool sucker. If we dismantle the pool sucker, the very tip of it is not completely open. There is, in fact, almost a little nipple or a little shelf that you have to clean as well. You can't get a brush all the way through that pool sucker. There's a little section of metal at the bottom over there that's also we need to take into account. When you've got a blind end or a closed end or something like that, then we need what is known as a fan-tipped brush. If we look at this one right at the very bottom over here, you can see that there are bristles right on the tip. That is a fan-tipped brush. That'll be ideal for the pool sucker. For other suckers, of course, we're looking for a brush that can pass all the way down the lumen, and we don't necessarily need something with a fan tip. So important to understand the brush for the particular lumen that you are looking at. What about the right size and the right diameter? Needless to say, if a brush is too small, it's going to pass through the device and there'll be no friction with the side walls. A brush that's too large, in fact, can also be a problem for friction. You don't get proper friction, you don't get enough friction if it's too large. It can get stuck and the bristles can break off. Looking at this image over here on the right, this publication was from Ofsted et al. And in fact, this is the suction channel of a flexible endoscope where a brush bristle has come off. So you can see the importance of having the right size brush bristle, as well as making sure that that brush is not worn. The ideal size has good contact with the side walls and very good friction. Now, we need to look at that diameter now that I wanted to talk about. We need to measure that we've got the correct diameter. We can do that using various charts, and of course there are various diameter measuring tools that we can use, and diameters all measured in what is known as French measurement. Some manufacturers refer to measuring that diameter, adding 3 millimeters, and that's the size brush diameter that you need. Others talk about a 1 millimeter add-on. Some refer to using just the same size diameter. So I guess that's going to depend on the design of the brush, the stiffness of the bristles. So remember, whichever manufacturer you're getting from, you need to know what you're looking at. Do I add a few millimeters to the brush size so I get the right size brush for the job that I'm doing? How long does the brush need to be? Some guidelines talk to measuring the total length of the device itself and then adding 5 centimeters, because that allows the brush to go all the way through the lumen before you come to the, not being able to pass it through. As a lot of the brush ends, of course, for these kind of devices has got a loop on the end, so you can't actually pass it all the way through. Where, of course, with the flexible endoscope, we tend to pass the brush all the way through, pull it all the way through. But with a device like this, like a suction, for example, we'll have a metal loop on the end of the instrument. So therefore, we need to make sure that the brush itself is 5 centimeters longer than the lumen of the type of device that we are cleaning. Let's have a look at some other devices, looking at this Yankau sucker over here. I'm sure you're all familiar with the Yankau. Remember, there is a big bulb in the Yankow sucker, cut out over here, looking at the lumen. To get a brush to fit down here, you need a relatively small lumen to get down the back end and the tip of a Yankow sucker, but the brush is never going to be big enough to clean the bulb. That's why we would advocate for using an ultrasonic cleaner with this kind of lumen. It's really, really impossible to clean this with the brush because you can't get the brush in of the right size that you need in here. Remember, research conducted in the South African setting, between 26 and 24% of all Yankow suckers that were tested were in fact positive for residual proteins, telling us that they were not clean. If we've got a nice little thin plastic sucker like this, here we have great chance of getting it clean using the right size brush. The bristles themselves are made of different types of materials. They can be made of synthetic materials like nylon, and nylon is gentler and a very, very effective cleaning bristle. Metals can include brass, which is a lot softer, and then there's stainless steel, which can be very abrasive. Now, we looked at those instructions for use from the orthopedic company, and it clearly said, do not use any stainless steel brushes on our instruments. So very important that you use the right bristle for the right job. Right design, right diameter. So what have we covered so far? We've reminded ourselves that if we don't clean an instrument correctly, especially a lumen or a complex device, there is a chance that we could give our patient a surgical site infection. We've now reminded ourselves of the different types of brushes: general, toothbrush style, lumen cleaning, channel or lumen cleaning, valve cleaning, acetabular type cleaning brushes. We've spoken about having the correct length of brush, the importance of the correct length, adding 5 centimeters. We've spoken about the correct bristle type, making sure that it's not going to damage, yet effectively clean, and then having the correct diameter of brush, that we have good friction and good contact. Now, what about brush motion? So we had seen in that one set of IFUs where they clearly said use a spinning or a rotating type motion when you're cleaning with the brush. Here's some research performed and published in the Association of Operating Room Nurses Journal, looking at the effect of the actual brush motion and rinsing when cleaning cannulated medical devices. For this research, they took 15 lumens, they soiled them with a particular test soil, and they used 5 different cleaning methods. In group 1, they cleaned with using high-pressure water only, so no brushing. In group 2, they brushed with a back and forth motion, and they did not rinse the brush in between. For group 3, they brushed with a back and forth motion, but took the brush out, cleaned the tip between brushing. For group 4, they brushed with that spinning helical spinning motion with no brush rinsing. And group 5, they brushed with that spinning motion and took the brush out and cleaned it in between. What were the results? The most effective was in fact that twisting, spinning motion, but rinsing in between. And the next best effective was back and forth with rinsing. So quite interesting to see, and you can see that manufacturer has already embraced this concept of cleaning with more of a spinning, twisting motion. Ultimately, the key takeaways from this published paper, the author stated that when cleaning with a brush, when manually cleaning our devices, we should always use the appropriate size brush for the device. That, of course, makes sense. To replace the worn and non-functional brushes, and the importance of rinsing the brush during the cleaning process. Those were the key takeaways from that particular research. Here's another one. This focused on cleaning gastroscopes specifically, also looking at different types of brushes and different types of motions. And in this particular research, which was published in 2025, they had found when you pass through the brush, through the biopsy channel at least 4 times, that's when you got the most effective removal of organic materials. I wonder how many times we pass through the brush when we're cleaning our flexible scopes here in South Africa. So coming to look at some of the tips of what it is that'll be the most effective way to clean and to brush. Clean on the dirty side of the CSSD, of course you know that. We speak of brush, flush, rinse and repeat, a very effective method of using your brush. Always cleaning under the waterline, of course, to prevent the aerosolization of microorganisms. Inspecting the brush before use to make sure it is actually clean and it's correctly functional. Inspecting the brush after use to make sure that it is clean and it's functional. Hopefully you haven't lost any bristles and they're not down the lumen. And cleaning the bristles before reinserting it when we are cleaning. Inspecting now, we've said we need to inspect. What are we inspecting for? Well, we're looking for missing bristles. We're looking for damaged bristles. We're looking for what is known as fallen bristles, so when they collapse down a little bit. And we're looking for damages to the handle or to the shaft. All of these 4 factors can affect the end of the day, the cleaning efficacy. If our brushes are not in good nick, we are not going to clean effectively. We may damage the instrument. We can even leave a bristle in an instrument, in a device, in a lumen that could be a foreign body that can cause a huge infection for a patient. Right, so moving on to looking at some images of what I've seen in the field. And take a few seconds to look at these images. So on the right, we've got a plastic tub container thingy next to the sink where these brushes were being stored. We've got brushes that are not clean. We've got brushes with fallen bristles and missing bristles and horrendous wooden handles. Please, dear heaven, do not use wooden handles. And then we've got this jug containery type thing on the left where all of our brushes are being stored, and in that you can see that they're not clean. You can see a standard domestic bottle brush for baby bottles. I hope that's not what they were cleaning here as well. We've got some steel wool in the mix and a whole bunch of, I don't know what else, maybe a Jacques catheter perhaps, not really sure. All sorts of odds and sods in this particular container. I hope that by now you're fully aware of the fact that this is really poor practice. It's really not the way to be cleaning, and we really should not be using steel wool. In my mind, that steel wool, certainly on the day that I saw it with my own eyes, was in fact starting to corrode a little bit. So we had a bit of corrosion from the steel wool, and you could only imagine how much damage a piece of steel wool will cause. Remember, you do not want to destroy the passivation layer on the instrument. If you destroy the passivation layer, you open it up to corrosion. You're also creating a fine little groove, and in that fine little groove is a place for a microorganism to hide. Brushes need to be stored in a manner that they are kept dry and that they are not going to be recontaminated. So looking at our images over here, this is some good progress in terms of how to store brushes. Looking at the image of the left, I don't know, but I'm not dead comfortable with that one. I don't like the idea that the hanging device that appears to be hanging homemade was made out of wood. Wood is definitely not a feature we want on our walls in our CSSDs. And then we've got somebody's eye protection quite close to the brush, and I think that we could contaminate here. There could be some situations for cross-contamination. Again, images from the field, metal brushes that I've seen, brass ones. The brass ones are quite soft, so they do actually fall quite quickly and they don't recover easily and stand back up again, those bristles. Whereas the stainless steel ones tend to be a little bit hardier, but they're hardier, they're going to damage. So really something you need to consider. And the horrendous scourer. Please, we do not want to be using scourers. They are abrasive, and they're also they catch debris. And you're going to have all sorts of debris sitting in there. They're quite hard to get them clean again. So debris lying caught into that actual scourer. I know that we have certain things that are difficult to clean, but really these are not the ideal tools to use. Again, some examples. The one on the very left, we've got a domestic bottle brush again. That's for bottles, not for instruments. If you look at the thin lumen brushes on the left, there are so few bristles left on them. I wonder where those bristles are. Perhaps in somebody's abdomen, for all we know. Looking at the one on the far right over there, that big brush with is not ideal. That's a domestic brush. The handle you can see is badly scored. So how on earth are we going to get the handle clean? If you look carefully, you might be able to see it's sort of a crossing over this not so clean green brush is in fact a piece of suture material that was not tangled in amongst all of these brushes on the day that I did the audit. Is this really the type of brush that we want to use? I don't think so. Like other implements, medical devices, proper brushes made for this right purpose. If you go and you want to clean your teeth, you don't use a shoe brush, you use a toothbrush, right? If you want to brush your hair, you use a hairbrush. You don't use a medical brush or a toothbrush. Brushes are designed for a specific purpose, as is a detergent. So here is an instructions for use, an example of an instructions for use from a device for a brush that is designed to clean medical instruments. Here clearly states what the intended use is, intended to clean dirty instruments during cleaning and decontamination process. Not intended to clean your teeth, not intended to clean baby bottles. It's intended to clean instruments and devices. Here it says the cleaning brush must be, after each use, we need to clean and disinfect the brush itself. That's important as well. It says over here, at the very least, we need to disinfect them daily. Now, brushes that you buy for the right purpose can in fact also be cleaned and disinfected in an automated washer disinfector. They're able to withstand the high temperatures of a washer disinfector process. So isn't that something you should be considering? How are you cleaning and disinfecting your brushes? Here, point 3 in these instructions for use, brushes should be inspected between uses and replaced when worn, frayed, bent, or otherwise damaged. Damaged brushes cannot clean effectively, and they cannot themselves be cleaned effectively. So we're not going to get the brush clean. Worn or damaged bristles and handles are ineffective in cleaning and may in fact damage the device that you are trying to clean. Number 4, this IFU states that brushes should be stored in a manner that will reduce cross-contamination. Right here, before we summarize what we've learned, I just want to have a look at the chat box to see if anything is coming over there. Thank you very much for everybody who have made some comments. Yes, you can put your brushes, if you've bought them from reputable stores and you've looked at the instructions for use, please confirm the instructions for use. Yes, some of them can go through an automated washer disinfector cycle. This session, we won't provide a copy of the session, but we will be recording this. It is recorded, and then we will post this on our YouTube channel, and in a week or so's time, we will send you the links. Remember, it is vitally important to use the correct brush for cleaning. The wrong brush can result in damage to the instrument and the patient developing a surgical site infection. The brush itself needs to be cleaned and disinfected. We need to carefully inspect them. We need to replace them when they're worn, and we need to store them carefully. If they are worn, we won't be able to, and damaged, we won't be able to clean the brush properly or disinfect the brush properly, which then means we will continuously recontaminate the devices that we are trying to clean. Hopefully that made good sense. As normal, we will send you, as I said, a link to a short survey, a few test questions in about a week's time, and a link to the recording of this, which will be hosted on our YouTube channel. Thank you so much for joining us today. I hope you found this insightful. So go on out there, get the right types of brushes, go inspect them, go have a look, go do a good inspection of what's happening there. And please, 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 let's all improve the cleaning of our devices for all of our sakes. Thank you so much. Hope you have a good day. Bye-bye.